Every human has two brains, the first one is located in the head, and the second one lies in the alimentary tract, being so-called gut brain. Gut brain, also known as enteric nervous system, contains 200 to 600 million nerve cells, running from esophagus to anus and independently regulates our alimentary tract functions. Thanks to normal enteric system, foods and drinks move through the digestive system by a process called peristalsis. Achalasia is a rare disease in which certain inhibitory nerve cells in the esophagus are damaged, making the esophageal muscles paralyzed and aperistaltic. This condition doesn't allow the esophagus to normally squeeze foodstuffs down into the stomach. In spite of being rare, achalasia is extremely important due to its serious complications such as considerable weight loss due to malnutrition, aspiration pneumonia, and esophageal cancer. Let's see what happens in achalasia. Human alimentary tract including the esophagus, stomach and intestines has four main layers. The innermost layer is mucosa or mucous membrane, which lines the lumen of the tract, and comes into direct contact with foods. Underneath mucosa is the submucosal layer. It surrounds the mucosa and contains blood vessels, lymphatic vessels, and a nervous plexus called Meissner's plexus, regulating mucosal secretions. Submucosa is followed by a smooth muscle layer being so-called muscular as propria. Like submucosal layer, a sophisticated network of neurons known as enteric plexus lies in this layer. It is responsible for the peristaltic movements of esophagus, stomach and intestines. The final layer is serosa or adventitia. It's mainly composed of connective tissue, giving strength to alimentary tract and holding it in place near the spine. In short, enteric together with Meissner's plexus form complicated neuronal circuits called enteric plexus. Medical experts believe that enteric system is our second brain, being responsible for regulating digestive system functions. In achalasia, the problem is in the muscular as propria of lower esophagus, where the enteric plexus is located. In this disease, two certain inhibitory neurons of enteric plexus become damaged. Nitric oxide-producing neurons and cholinergic neurons. This results in depletion of both nitric oxide and acetylcholine in lower esophageal body and esophageal sphincter. Note that both of these neurotransmitters are crucial for normal esophageal peristalsis and esophageal sphincter relaxation. Normally, esophageal muscles contract to push the food downward. When food reaches lower esophagus, the esophageal sphincter then relaxes to allow the food into the stomach. In achalasia, lack of these neurotransmitters makes the esophageal wall paralyzed, flaccid, and dilated, and the esophageal sphincter stiff and hypertonic. So, food materials collect and sometimes ferment in the esophagus instead of getting normally into your stomach. In a nutshell, achalasia is a kind of neurodegenerative disease, resulting in loss of certain neurons and paralysis of both esophageal body and esophageal sphincter. Before going through the rest of the video, if you have found the video informative, make sure to smash the subscribe button and ring the bell to get notified when new episodes are released. With achalasia, children develop different symptoms. Difficulty swallowing or dysphagia. This feels like food materials are stuck in your throat. Regurgitation, meaning that foods, drinks or even saliva come back into the mouth from esophagus. Occasional chest pain. This is mainly because of stiff and spastic esophageal sphincter. Muscle stiffness can cause pain, remember. Bad breath or halitosis being due to food fermentation. Heartburn, hoarseness or sore throat, vomiting and frequent coughing. Hopefully achalasia is very rare among children. Less than 5% of achalasic patients are children younger than 15 years of age. Medical treatment like nifedipine pills that relieve patient symptoms by reducing esophageal sphincter pressure, are not commonly used in children. Endoscopic treatments like pneumatic dilation or Botox injection, and surgical treatments like Heller myotomy, are available choices for treating pediatric achalasia. All these treatments mainly focus on reducing esophageal sphincter pressure to facilitate esophageal emptying. In children, surgery is the most definitive and successful treatment of choice. Heller myotomy is a surgical treatment of choice for achalasia in which the thick muscle of the lower part of the esophagus is cut, allowing foods and liquids to pass to the stomach. Thanks for your watching. Please let me know the pediatric issues you are willing to learn. Write them in the comments for me. Good luck.